Hi, everyone. I'm Michael George. Thank you for joining us. The summer surge of coronavirus in the U.S. is leading to the highest number of new cases some areas have seen this year. Overall, daily cases in the U.S. have reached levels not seen since February, and an average of 100,000 new cases a day. The highest concentration is in areas with low vaccination rates and resistance to mitigation efforts. Health officials are also concerned that many of these new cases are in children. CBS News senior national correspondent Mark Strassmann has more.
Cajun country versus COVID. It's not a fair fight. Louisiana has one of America's lowest vaccination rates. COVID hospitalizations are 8 times higher than they were 5 weeks ago.
People are younger and sicker, and we're intubating and losing people that are my age and younger.
In 2 weeks, 1% of Louisiana's entire population has caught the virus.
We have no reason to believe in our data that we reached the peak or that we're coming down. We have more children sick with COVID-19 than at any other time during the pandemic.
Across America, 71,000 kids tested positive in the last week of July. 1 in 5 new cases, as the Delta variant stalks the unvaccinated of all ages.
The level of sick visits that we've seen this summer, June, July, and now August, I've never seen in 20 years of practice here in Houston.
Another negative, surging positivity rates. 20 states are over 10%. More alarming, Idaho, Oklahoma, and Mississippi over 40%. 2 states, Texas and Florida, make up nearly 1/3 of America's new COVID cases. Both governors oppose universal masking as schools open.
We can either have a free society or we can have a biomedical security state. And I can tell you, Florida, we're a free state.
Free state, costly approach.
So we have basically patients everywhere in both sides of the unit.
On Friday, the state set a daily record, nearly 24,000 new cases. Hospitalizations have quadrupled in a month. Deaths have doubled. Despite the runaway spread, COVID's culture war is unrelenting. More schools open this week. More parents will square off about protecting kids.
Can't mask the kids. It's unconstitutional. It's child abuse, and everybody knows it.
Anti-maskers, anti-vaxxers.
These folks back there have lost their mind. You've lost your minds. You are the ultimate knuckleheads.
The only way to fight against it is we get the shot.
Urgency now drives vaccination campaigns. Right behind the Delta variant lurks the Lambda variant. More employers have a new vaccine policy. Get it or get gone, including Microsoft, Tyson Foods, and United Airlines. Here in Georgia, the number of new daily cases is at its highest level since late January, before the vaccine was widely available. Hundreds of them in Metro Atlanta are kids. Michael, they tested positive during the first week of school.
Mark Strassmann, thank you. Joining me now is Dr. William Schaffner. He's a professor of infectious diseases at the Vanderbilt University Medical Center. Dr. Schaffner is also a member of the CDC Advisory Committee on Immunization Practices. Doctor, thanks for joining us.
Good to be with you, Michael.
Well, let's start off with this. The nation's largest teachers union is calling for teachers to be vaccinated as we approach back to school, but how close are we to children under 12 being eligible for vaccination?
That will take a little more time. You know, those studies are currently underway. We don't want to rush those. The best anticipation is that late in the fall, perhaps early in the winter, those studies will mature, be reviewed by the Food and Drug Administration, and vaccine will be available for children under 12. But in the meantime, we have a vaccine that works for children 12 and older, and we have many of them, Michael, still to vaccinate.
Doctor, good point. Now, if children under 12 can't be vaccinated yet, there still is the protection of masks. But as we've seen, even that has become a political issue for some. Should students and teachers be masked going back to school?
Well, first of all, I think every adult associated with school should actually be vaccinated, of course, and they should be wearing masks. The American Academy of Pediatrics, 80,000 pediatricians who are committed to the normal and healthy growth and development of children say that every child who goes to school in the United States should wear a mask. And of course, the adults ought to also. It's another layer of protection. We know the masks work and they're safe.
Now, in San Francisco, city officials just approved a request in regards to people who got the Johnson & Johnson vaccine. They're now allowed to get what they're calling a supplemental dose of the Pfizer or Moderna vaccine. But the CDC is saying not to do that. So can you clarify some of the confusion around getting a vaccination boost?
A little bit complicated. The CDC is under active discussion, as is the Food and Drug Administration, of getting an extra dose for people who are immune compromised, who are cancer chemotherapy or they're transplant recipients, because the original series didn't work optimally for those people whose immune system is suppressed. That's different. We're thinking of that as a 3-dose series for those immune suppressed people. You're talking about a booster, an additional dose for people who already have had a good response. We're not there yet. CDC has not made that formal recommendation, and that's because the protection from the current vaccines seems to be maintaining itself very nicely.
Doctor, the overwhelming majority of new COVID infections we're seeing in the U.S. are among the unvaccinated. So how could what's happening with them change things for the people who are vaccinated?
Well, the virus is being transmitted very, very rapidly and intensely among unvaccinated people. And of course, when that happens, there'll be some spillover into the vaccinated people. Remember, the vaccines are 95% effective, not 100%. So we will expect some breakthrough infections. Fortunately, the vast majority of those breakthrough infections in people who already are vaccinated are very mild and do not require hospitalization. We need to get our friends and neighbors who are unvaccinated vaccinated tomorrow. I would love it.
Doctor, you're a member of a CDC panel. Give us a sense of how much of an issue misinformation around COVID and the vaccine is for you in the medical field.
Oh, it's constant. There isn't a day that goes by that I don't respond via email or to journalists about a whole array of issues related to the vaccine and COVID itself. Please listen to the public health authorities. Put that social media stuff aside. COVID is bad. It's not going to disappear. Vaccines are good. We need people to all participate and get vaccinated. Please get your vaccine.
And to that point, about 100 million people right now are eligible to get the vaccine, but they haven't gotten it yet. What do you think it's going to take to convince them to get vaccinated?
A whole lot of things, Michael. One is, if the Food and Drug Administration would please formally license this vaccine, that would take that issue off the table. Others were doing one person at a time, trying to answer their questions. And then, of course, quite frankly, we've heard those words in the last several weeks, obligatory required mandates. I think as the need for this vaccine gets even more intense, there'll be more obligations to get vaccinated, whether in the private sector or if you're in the military, and certainly in healthcare. We in healthcare are going to be obliged to be vaccinated. It's happening in my medical center as we speak.
Dr. William Schaffner, thank you for your time.
Thank you, Michael.